Right, concerns over COVID-19 caseloads here in Korea are being compounded by confirmation of the country's first Omicron infections. For more, I have Choi Min-jung in the studio with me. Min-jung, welcome back.
Thank you for having me, Sunny.
Right then, let's begin with details of Korea's first cases of this new variant, Min-jung.
Right, on Wednesday, South Korea confirmed 5 cases of the Omicron variant. A married couple in their 40s contracted this variant after visiting Nigeria in mid-November. Their friend who drove them home from the airport was also infected with the new strain. And also their son has been confirmed with COVID-19 and will know if he is carrying the Omicron variant when further test results come out on Thursday. Health officials are on high alert as the couple was fully vaccinated with Moderna shots back in October. This also means that they could have come into close contact with many other people as they were exempt from quarantine after arriving in Korea. Officials say that the couple and their friend are experiencing no unusual signs of illness other than respiratory symptoms and muscle pain. Apart from the 3, 2 more people have also been infected with the variant. The variant was detected in 2 unvaccinated women in their 50s living in Gyeonggi-do province, and it turns out they also traveled to Nigeria in mid-November. Besides the 5 who tested positive for the variant, there is a total of 4 more suspected cases that are pending test results.
Right, and understandably, Min-jung, there is heightened fear about a fresh wave of infections in the days ahead.
You're right, Sunny. Over the past month, some 5,000 people arrived in South Korea from Africa and Europe, where the Omicron variant is spreading quickly. Some experts say transmissions of the variant may already be taking place in the local community. At the National Prayer Breakfast this morning, President Moon Jae-in also acknowledged the situation as a challenge in the country's efforts to return to normal. Let's take a listen.
단계적 일상 회복으로 가는 길이 순탄치 않고 신종병이 오미크론의 위험성이 높아지고 있습니다. 정부는 하루빨리 일상을 회복하는 데 전력을 다하겠습니다. 국민의 걱정과 불안을 덜어드리고 더 나은 일상으로 도약할 수 있도록 최선을 다할 것입니다.
Right, Min-jung, and as part of such efforts, I understand entry protocols have been toughened at airports. Tell us more.
That's right. All travelers arriving in South Korea, regardless of their nationality and their vaccination status, will have to quarantine for 10 days. The new measures will be implemented on Friday and will be in effect for the next 2 weeks. Those in quarantine must also undergo a total of 3 PCR tests. That would be once before the flight, another after arrival, and a final test before their release from quarantine. Foreigners visiting Korea for short-term stay will be quarantined at temporary shelters provided by the government. And also starting Friday, the entry of non-Koreans departing from Nigeria will be banned. But Koreans and foreign residents with long-term visas will be permitted to enter Korea from Nigeria, but they will have to quarantine at a state shelter instead of home and take 4 PCR tests as well. The same measures had already been put in place for 8 other countries in southern Africa. The government has also decided to suspend direct commercial air routes from Ethiopia for 2 weeks starting Saturday. But the country will be chartering separate flights to ensure the safe return of Korean nationals.
Right, I see. And in the meantime, Min-jung, what are the guidelines for those who come into close contact with Omicron patients?
They would be subject to 14 days of isolation, and there are no exceptions even for fully vaccinated people. Currently, those who have completed their vaccine regimens are not required to quarantine even after coming into close contact with a COVID-19 patient. But this rule will not be applied when it comes to the Omicron variant.
I see. All right, Min-jung, thank you for now. Stay with us for the broader talks.
Thank you.